Our closing remarks today will be delivered by Ambassador Vijay Nambiar. Ambassador Nambiar is a retired diplomat and former special advisor to the UN Secretary General. He has worked in Algiers, in Afghanistan, Malaysia, China, and Pakistan. He was also a permanent representative to India's UN mission in New York. He has been seconded to the UN as special advisor to the UN Secretary General Kofi Annan, and later was chief of cabinet of Secretary General Ban Ki-moon and his advisor to Myanmar. We have also had the privilege of having him on our advisory committee for this summit. Please join me in welcoming Ambassador Nambiar to the stage.
I've just been to 2 of these sessions after lunch, and both of them have been fascinating. I'm sorry I was not able to attend the morning session. It was a personal emergency, and I had intended to come. So if I make these closing remarks without reference to the details of what was discussed this morning, you will please excuse me. It has, of course, been a great pleasure and privilege to be here at the Health and Humanity Summit. I don't actually claim to be a domain expert, as Sana has explained. I'm just an extinguished diplomat, let's say. But I have been in touch off and on with the humanitarian landscape in the course of my experience at the United Nations. And the humanitarian landscape is evolving rapidly. Aid and development organizations are at a turning point and urgently need to change their strategies and methods of functioning in the face of the major disruptors like climate change, the information explosion, you call it infodemics, and the changing geopolitical landscape. Now, approximately 339 million people are today affected by humanitarian crises, covering 68 countries of the world. The number is growing by leaps and bounds. UN OCHA's Global Humanitarian Overview rightly puts the spotlight on neglected countries such as Afghanistan, Congo, Ethiopia, South Sudan, Ukraine, and Yemen. As in the past, OCHA faces huge funding shortages. As Tamam Aludat of MSF Netherlands had declared, it is perhaps time to de-hierarchize or democratize funding decisions among donor countries. Major donors like Gavi are trying to step into the breach, but it is still not enough. The aim of this summit has been to stimulate discourse on humanitarian and public health issues to encourage new perspectives and innovative approaches to aid. It seeks to foster dialogue, hold networks, partnerships, and collaborations, and we have concrete instances of what has emerged this afternoon, and connect those who work in the humanitarian space to other spaces like those of technology and innovation, climate, and the information ecosystem. We must recognize that migration and increasing levels of human mobility are part of the interconnected world we live in. We cannot pretend that they are not around us. Worse still, try to stamp the reality out. The challenges many of us face in serving people on the move are varied and diverse. MSF's displacement and migration operations respond to people in danger, acting on health-driven needs amid vulnerabilities, regardless of any individual label. Meanwhile, conflict-affected groups face a double jeopardy of gross susceptibility to climate change impacts, multi-generational poverty, and major setbacks in educational attainments, child development, and more. This summit has trained the spotlight on several key dimensions of that tricky problem of access to basic entitlements and justice for conflict-affected populations of the world. Let me talk about some of them. 1, MSF defends the concept of the right to refuge in the widest possible manner, covering violence perpetrated within the country of origin or rampant persecution outside a country of origin. Acts of assistance or solidarity towards these affected populations must not be randomly criminalized, even when we recognize the need to firmly countenance the exploitation of such situations by criminal networks. Permit me to recall my own experience around a decade ago as the UN Special Advisor on Myanmar. This was some months after the June 2012 communal tensions that had erupted into open conflict in the Rakhine. While the situation in the country was tense and simmering, it seemed hardly likely that they would be reflected in the predominantly Buddhist part of the Mandalay region of central Myanmar. But this was precisely what happened in the town of Mektila in the same region that had a considerable Muslim population that were resident in the area for generations, even centuries. A petty dispute in March 2013 in a goldsmith shop grew into a bazaar brawl and soon exploded into a full-blown riot. Even as pent-up animosities between the communities burst into the open after being provided ample incitement from both sides. What was striking in this case was the relatively quick action by the authorities and the fact that the president, Thein Sein at that time, he was a former military man, was persuaded to speak out publicly, committing the government to take strong and transparent action. Public action on the ground. Top leaders were quick to get to the trouble spot, and the government also devised a plan to deal with the media to take control of the public narrative at an early stage and stem the cycle of violence among the people before it spread to other parts of the country. I recall being present for many public meetings, 3 of them at least, of government and of interfaith leaders to spread the message of harmony. What this incident tells us is that with an exercise of will, right intent, and strong leadership, a major human catastrophe with horrific displacement possibilities can be averted. But sadly, such an approach, this same kind of approach, was singularly lacking in the actions of the Myanmar army in Rakhine just a few years later. That is how the world functions, I guess. We are all aware that MSF operations respond to needs that are exacerbated by policies repelling and containing people on the move and deepening their vulnerability. By closing out safe alternatives, these policies sometimes prevent people escaping situations of violence and deprivation, increasing their vulnerabilities, or forcing them into limbo to return or to go underground. Refugees and migrants face serious challenges which host country governments, NGOs, collectives, and the private sector must recognize and do more to address. It is also important to realize that the health concerns of displaced groups may not be limited to the immediate effects of conflict, such as trauma or injury. Displacement means the unsettling of continuums of care related to pregnancy, non-communicable disease, treatment of cancer, of childhood illnesses, and of mental health. Refugee host countries, with some exceptions, are often ill-equipped to address with these challenges. 2, access to products for healthcare is an essential aspect of access to care and is integral to the implementation of MSF's social mission. South Asia needs to develop a resilient healthcare system and an inclusive environment that caters to the need of all, irrespective of their mobility status. Our COVID experience has underlined the need to prioritize the well-being of people over profit-driven motives. The substitution of WHO's disease-oriented policy with a security-oriented policy obfuscates health response vis-à-vis access to medicine and overshadows critical discussions on social, economic, political, and other non-medical determinants of health. This is a point that Nishant Sirohi has made even this afternoon. He, for example, related the IHR legally requires member states to maintain certain monitoring and surveillance capabilities to report on infectious outbreaks. However, the WHO does not provide additional funding support for the same purpose. With limited funding, the states in the global south in many cases prioritize international compliance and underperform on strengthening the public health systems. Whereas the global north continues to benefit from the health monitoring and surveillance data received from the global south, the medicines, drugs, and vaccines developed using data from the global south are patented in the global north by the pharmaceuticals companies of this region and marketed across the world. A lack of adequate access to healthcare continues to engender unacceptable levels of suffering in places where MSF intervenes and beyond. It impedes their ability to provide quality medical assistance. We know that only concerted international political efforts could address its fundamental underlying causes. India's contribution to the breaking down of patent barriers and producing generic versions of essential drugs has effectively reduced costs and expanded access to life-saving treatments, particularly in South Asia. Sustaining this momentum will require a steady focus on research and development and develop new and affordable health solutions. The conference has sought to look at exemplars of justice and equity, particularly in relation to affordability of medicines. Here, there are instructive lessons of what to do, for example, in the context of HIV drug access, as well as what not to do. We would do well to learn from these histories and experiences. 3, we just heard at this session that the increased recourse to misinformation and disinformation has lethal implications in today's world during emergencies as they exacerbate crisis situations and hinder response efforts. One of the biggest tinderboxes of conflict itself is misinformation. Campaigns of disinformation have wrought great harm and inflamed conflict while also impeding response, recovery, and reconciliation efforts. In relation to health, this has immediate repercussions. Interrogating the role of technology in both propagating and mitigating misinformation has been a major theme, as we saw just now. Building community resilience through innovative technological solutions can help them unite, adapt, and combat the challenges. But we may need also to change the methods and assumptions at play in many such debates that digital technologies are intrinsically good for affected populations and that the risks they may bring are easily mitigated. This assumption may need to be seriously revisited. For this, it is necessary to promote, as has just been said, better media literacy and provide clear and accurate information, especially during emergencies. This will be a continuing challenge in the future. 4, the rising incidence of armed conflict, criminal activities, access restrictions, violence against aid workers, and pandemics have the potential to disrupt healthcare delivery, hinder access to affected populations, compromise the safety of personnel, and create an environment of fear and instability. It also increases mistrust and misunderstandings between communities and seriously affects vulnerable populations, including minorities, women, children, and migrants. It is well acknowledged that India's community health workers, known as ASHA, accredited social health activists, are the bedrock of our health system. But a recent study unveils the risks they face in conflict-prone areas from hostile attitudes of the communities they serve, due to the breakdown of social relations, displacement traumas, etc. Despite this, they work to strengthen the stability of the health system there. We need to listen more deeply to the immediate challenges of communities and community actors, while also collaborating with them on solutions for peace building and restoration of health in conflict-prone areas. Finally, we speak today of the need for a broader definition of the global health security. Security that is planetary, that encompasses the interconnections between human, animal, and environmental health. Only by recognizing these complex interlinkages can public health efforts proactively mitigate risk and protect vulnerable populations from a wide range of health threats. This Health and Humanities Summit also seeks to explore as what is described as slow burn challenges that are quite often protracted and have implications for linked ecosystems across our species and others, as well as in the planet as a whole. Meanwhile, the health security strategies of global government institutions and developed nations seem to have largely focused on surveillance and monitoring of infectious diseases outbreaks and spread from the global south to the global north, again, as mentioned this afternoon by Sirohi. The pandemic highlighted that such data sharing systems are insufficient if developing countries continue to struggle to access vaccines, medicines, and technology to address health issues. The failure of WHO's COVAX initiative, the adoption of a watered-down TRIPS waiver, discriminatory measures like COVID-19 vaccine passports, etc., contributed to a poor response to the COVID-19 pandemic. For the future, at least, global governance institutions must adopt a rights-based paradigm that focuses on strengthening health systems and infrastructure for delivery and access to healthcare, rather than look at what Nishant called securitized containment alone. Moving into the future, while humanitarian assistance can be called upon to be provided in a principled manner, we must also work steadfastly to reduce risk and vulnerability. This will also necessitate working in harmony with development actors towards collective outcomes. We need to break down silos rather than focus only on individual institutional mandates. It will also call for closer cooperation with local actors to ensure that we support them rather than replace them. Funding will have to be more creative and innovative, as well as flexible, while remaining transparent and accountable. However, it is undeniable that even while viewing humanitarian assistance within a broader development and resilience agenda, or even within the 2030 Agenda of Sustainable Development, we cannot ignore the fact that humanitarian action and emergency response, especially in conflict or epidemic situations, have by definition a sui generis character. Countries must be called upon to fulfill their obligations under humanitarian and refugee law and be willing to step up to the plate. Meanwhile, the change the world is undergoing will inevitably take us out of our comfort zone and into uncharted territory. We are talking of a pandemic accord already now. But that must not deter us from moving with increased energy and determination to meet the challenges before us and serve lives, protect people, and give them hope for the future. Thank you.